Our question of the day. We asked you on Facebook, Twitter, and on Instagram, what questions do you have about COVID as your student returns to school? We have Dr. Peter Chin-Hong, infectious disease expert at UCSF. He's here live to help answer some of these questions. We also took your questions to some of the Bay Area's largest school districts. Hi, Dr. Peter. We just showed a graph of who's getting COVID. And it's a lot of kids under the age of 18. And last year, it seemed like those younger kids weren't getting COVID. I remember speaking to you, and that's why they were allowed to go back into the classroom first. But with the Delta variant, is that all out the door now?
Well, it's out the door a little bit, but then not quite. So we're seeing more cases in kids, but it's really because we have been seeing fewer cases in the older folks. So proportionally speaking, kids are more affected. But only 1% of these hospitalized. So by far the majority of kids, when they get it, is, they're like having very cold-like symptoms, even though they're not vaccinated. And very few are going to the hospital. So that's kind of what we're seeing. Most of the kids are getting it in the community. Even in the biggest surge of last year, when we look at the data, the kids were really getting it in the community. The schools are a very controlled environment compared to what's going on in real life.
That's very reassuring. Now, we have some viewer questions that you're going to answer for us. Jessica asked, are teachers required to be vaccinated? Now, we touched on this just a little bit when it comes to Oakland Unified. They don't require it, nor does the state of California, but some districts are choosing that, like San Jose Unified. They're requiring staff members to get vaccinated, but those who don't, they must get tested twice a week. Now, Dr. Peter, what's your take? Should teachers be vaccinated? And if they don't want to, frequent testing?
Well, Janelle, I think about it like healthcare workers. It's not a bad idea. We are taking care of vulnerable patients. We don't only think about ourselves. But I would say on the upside, statistically speaking, your teacher, even though he or she is not mandated to get a vaccine, would have had a vaccine more likely, just given the fact that so many of our population is vaccinated in the Bay Area compared to many other states.
Our next question comes from Elaine. She asked on Facebook, if there is an outbreak, what are the measures being taken? This is a look at what the state recommends. As long as everyone who was exposed to COVID-19 in the classroom was wearing a mask at the time of exposure, they can keep coming to school, as long as they don't have symptoms and undergo twice weekly testing over a 10-day period. They must also continue to wear masks and cannot participate in extracurriculars during that time. Okay, Dr. Peter, do you agree? A student gets COVID, they can still go to school. Should I, as a parent, be worried about sending my kid with that kid to class?
No, not necessarily, unless that kid has symptoms. And the reason is, again, you're wearing a mask, which much reduces the probability of that kid getting an infection, even though they may have had that duration of time. Plus, under 12 years old, less likely to get and transmit COVID in general. So you're taking a low probability event in a low probability population. So I think what those measures are sound very reasonable to me.
Well, it sounds like masks are very effective. This brings up this last question from Joel. If a vaccinated person can still get infected by the coronavirus, then why are we requiring masks for everyone? So, Dr. Peter, you're saying they're basically still effective. That's the best way to prevent getting COVID-19?
Yes, exactly. So there are two reasons to why we're wearing masks now. First of all, I would say overall it's just a pause strategy. I don't really think masks will be here forever, and it's really just to put a pause button on this tremendous surge we're seeing. The second reason is you can't look around the room and tell who's vaccinated and not. And we know that, when that virus lands on somebody who's not vaccinated or who can't get a response. So people might have gotten vaccinated, they're immunocompromised transplant, they may still not have protection. And third reason, of course, it's still a bummer to get COVID, even if you're vaccinated and it's going to be like a flu, because you have to stay home from school or work. You have to tell all these people you're in contact with that they should go and get tested.
Okay, Dr. Peter, I have a personal question. I have a 5-year-old who's going to kindergarten next week. Many parents are sending their kids back to school for the first time in, a year, in 4 or 5 months. besides wearing masks indoors, any other suggestions? Should I have her carry sanitizer into her classroom? Any other tips for concerned parents like me sending their kids off to school for the first time?
Yeah, so there's definitely, Janelle, there are many of options that the CDC provides, and you don't have to do all of them. But masks, of course, are the easiest thing. Ventilation, I think in sunny California, we can do that. Desks 3 feet apart, not mandatory, but if you can do it, it's one of the menu. And the most important thing, vaccinate as many adults in that child's life as possible. You want to form a wall of immunity around that child.
Yeah, okay, great tips, very reassuring. We love your expert advice. Dr. Peter Chin Hong with UCSF, thank you so much for joining us tonight.